Okay, thanks, Zainab. From what I can see at the moment, we've got Christo, Kyle, Pasquale, and Shiva joining us. So, hello all. Um, I think what I might do is I'll just get talking. And if you do have any queries or questions, please send them through. But as um, I think the important message, as Zainab mentioned earlier, is if you do have things that come up from this and maybe you don't feel comfortable at the time raising them, or they come up later after I've finished chatting with you today, please feel free to get in contact with me to clarify directly. I can either do that as a phone call or even meet with you, or certainly on email. Usually gets a quick response as well. So, like I said, please, I hope to answer your questions, um, or at least give you relevant advice. But if I don't cover things that you would like covered or you still have outstanding concerns, then please just let me know. So I thought what I'd do is just give you a bit of a background of the course. But importantly, I was going to start off by telling a bit of a personal story, just so you get a bit of a feel for what it is that we teach here and that we focus on at the University of Sydney, specifically in the new Masters program. And Zainab, are you able to move forward the slides, or am I able to do that myself?
You should be able to click because you're host, but I can do that. Yep.
Yeah, sorry. I'll try doing it myself, but it doesn't seem to do it for me. So as I said, I'm Nathan Johnson. I'm the course director of the Masters. I am an exercise physiologist myself, and I have been since about 2004 or 2005, so quite a while. And at the moment, as well as teaching and doing research, which I'll talk about in a second, I practice in the Royal Prince Alfred Hospital clinic, where we have a clinic that has exercise physiologists in it. And so that's pretty exciting. And I see all sorts of patients, and I'll certainly, I use that as part of my teaching during the Masters. And in particular, I tend to see patients who particularly are coming for reasons of metabolic disease, especially, and some cardiovascular disease. But as you will experience with exercise, a whole raft of patients ranging from people that have musculoskeletal conditions to mental health conditions, to cardiovascular, metabolic conditions, and often many of these combined or comorbid conditions. So it's a really interesting job, and I certainly enjoy it. So that's me, but beyond me, we have about 20 odd staff here at the discipline of exercise and sports science that teach, many of whom teach into this program, and many of whom are medical doctors and exercise physiologists themselves. As I said, I thought just to get a bit of a flavour for how we encourage thinking here at the university, and particularly in this new Masters program, I thought I might share a little bit of a background to the sort of research that we do and a research project that we've just currently finished. So I don't know if I can get a show of hands on a written response from the people joining us, but perhaps you could let me know whether you all come from an exercise science background or if we've got people joining us that aren't from an ES background. But if you are from an ES background, based on what you've learnt from your undergraduate degree, reflect for a moment on how much exercise you need a patient to do to actually lose weight. So my simple question that I often ask in week one of something like a Masters is, if you have a patient, and like many of our patients, most are overweight or obese, and weight management is an important part of their health management, how hard is it, or how easy is it to actually lose fat? How much energy is there in a kilogram of fat? Do you know? Zainab?
No.
Sorry, that was more of a cue to move me forward, but you've forgotten.
I have.
There is certainly a lot of energy in a kilogram of fat. In fact, there's probably about 37,000 kilojoules worth of energy. And so when we think about exercise for weight management, often, and even people coming from an ES degree tend to have the misconception that as soon as their patient does exercise, they will shed fat and lose it easily and quickly. And so if Zainab helps us move through the
Nathan, sorry just to interrupt. I've just given you remote control access. So let's give that a try again to see if you're able to click forward. Does that work? Excellent.
Yes, thank you.
Perfect.
Thank you. So for our 37,000 kilojoules that we need to expend to lose a kilogram of fat, and bearing in mind that most patients need to lose more than a kilogram, it's often 10, 20. I've had patients that need to lose 80 kilograms of fat to get to a healthy level. But the reality is exercise doesn't do this particularly well. So for instance, if you're looking at doing 30 minutes of exercise a day, and that's what we recommend for many people, at a moderate intensity, something like 50% of VO2 max, and your VO2 max was about 3.5 litres per minute, which would be the typical fitness level of many patients we'd see with this condition. What we're talking about is expending about 1,100 kilojoules per session of exercise, or needing to do this for about 34 days worth of exercise just to lose a kilogram of fat. And of course, many of you know that not all our energy comes from burning fat. About half of it at a moderate intensity comes from oxidizing glucose. Mm-hmm. So in fact, for many of our patients, we have the reality that if they need to lose something like a kilogram of fat, it may take them something like 70 days just to do that. If they need to lose 10 kilograms, we're looking at years and years. So that may shock you, and I hope it doesn't if you're from an ES background, because the evidence is quite clear on this. And you can see this is a great study, a meta-analysis done showing the average weight loss from different types of therapies. So you can see that there are some successful therapies like very low energy diets and some medications that are reasonably effective at helping some fat loss. But when it comes to exercise, which is the yellow one here, and really importantly, giving advice on exercise, you can't expect significant weight loss, if any weight loss at all. It's just not effective. And that's a reality. And this is one of the core approaches and fundamental things that we focus on in this degree, is helping you think about what is evidence-based practice. It's one thing to actually think exercise is just brilliant for everything, and it's another thing to actually use it based on best evidence in a targeted way for the condition or the conditions you're trying to manage. So the reality is, based on the evidence, when you have a patient who is overweight or obese coming in aiming for weight loss, based on the evidence, you have very little chance of achieving significant weight loss with the sort of exercise doses we give people. And that's how we want you to think. And what we particularly want you to do is to, as graduates of this program, is to start pushing this profession forward and to start rethinking the way you may have thought and the way we typically approach exercise. So an example of this is, thanks Pascal, it is, scary, but awesome. And one of the things that you may be familiar with, and certainly you probably are familiar with this if you've come from an undergrad background in exercise science, is a thing called HIIT training, high intensity interval training. And so you may have walked away from your undergrad thinking that HIIT was brilliant for everything, and it's certainly brilliant for many things. But the jury is really out on whether it's useful for weight management. So we had the question in our last research study that we've just finished, and this should be hitting good reputable journals near you anytime soon, is could we give 4 minutes of exercise 3 times a week to people who are overweight and obese and get health benefits from it? Do we expect significant fat loss or weight loss from it? Not really, because as we just went through, once you understand the physiology of this and the sheer mechanics of it and the science of it, it would be impossible to expect that sort of weight loss with that level of energy expenditure. It doesn't work like that. It just defies physics. But that's treating the management of an obese person too simplistically. So if a patient comes to see me for managing their obesity, it isn't all about their weight loss necessarily. They might have comorbid other conditions like insulin resistance, high blood fats or dyslipidemia. They might have high hypertension or high blood pressure, as well as other things. And so that is a useful part of our targeted therapy as well. We might be looking for other therapeutic outcomes beyond just weight loss. But importantly, even when it comes to the issue of obesity and weight management, we, from the scientific side of things, now know that it's not just about weight. It's probably more important to know about fat and where fat is in the body and trying to lose that fat. So you've probably heard of this yourself, but there are certain fats in the body, and they're often referred to as ectopic fats, that are particularly bad. And it seems to be that you can potentially be significantly overweight, but as long as you have low levels of these ectopic fats, you can be otherwise healthy. So the problem overall is there are limited approaches for losing weight anyway, other than surgery and some significantly extreme nutrition therapies that tend to be used short term. Exercise is quite ineffective. And so we need to start thinking beyond just weight loss to broader management. And one of the aspects of that is thinking about the partitioning of these bad fats, getting rid of bad fat from the wrong places. And you may be aware of some of this, and this is pretty awesome data if you're not aware. This is a study, for instance, that got all the studies that have looked at the effect of giving exercise or giving diet on losing fat around the organs that we call visceral adipose tissue. And this is the really bad fat, or one of the really bad fats in the body. And what they got was they got together all the studies that had done this and measured this fat before and after. And what they found was that even though weight loss was better via diets, people tend to lose more weight with a diet than they do with exercise for the same period of time. Interestingly, even though they don't necessarily lose as much weight, people tend to lose fat better, or visceral fat in particular, more. They get superior reductions in it with exercise than they do with diet. In fact, a diet is completely ineffective for reducing visceral fat unless you lose weight. Whereas with exercise, you actually don't have to lose weight to reduce visceral fat. And this is the fat that's linked with things like diabetes, with cardiovascular risk, with hypertension, and all the other nasty things that come with obesity. It's not actually the fat stored subcutaneously elsewhere in the body. So that's really the background of a lot of the research we've done recently. And one of these fats in particular is fat that's in the liver, called hepatic fat or liver fat, and also fat that's in the pancreas. So this tiny little organ, when it gets too much fat in it, tends to overproduce a hormone called insulin that you may remember, and that contributes to the problem of diabetes type 2. And it's already been shown that if you can reduce the amount of pancreatic fat, even if people don't lose weight, they can restore the function of their pancreas. And so it secretes insulin normally again. So we've just done a study in overweight and obese adults with type 2 diabetes who previously didn't do exercise, where we gave them either traditional exercise, moderate intensity continuous exercise, 3 days a week, and aiming for about 45 minutes a session at a moderate intensity, or we gave them just 4 minutes of high intensity interval training. One single 4-minute bout that they did at about 90% of VO2 max, and then they went home for the day. And we saw them again in 2 days' time. They did it 3 times a week. In other words, 12 minutes of exercise a week. Or we gave them a placebo control. So this is called a randomized control trial. And we measured all these fancy things using MRI scans to look inside the pancreas and in the liver and all this kind of stuff, as well as some traditional measures that you're probably more familiar with, like glucose outcomes, blood glucose, blood fats, cholesterol, etc., blood vessel function, fitness levels, body composition, and some other measures as well. And what we found, as we'd expect based on the evidence, is people didn't lose weight. They rarely do with exercise, or we wouldn't expect that they would with this dose of exercise at the very least. But they did lose significant liver fat and pancreas fat using this fancy technique that I won't go into details with here. But in both the moderate intensity group and the HIIT group, they lost liver fat. And we now know exercise is one of the only therapies beyond weight loss that can help reduce liver fat and restore normal liver function. But it seems to be this is the first study to also show that exercise, in this case, only the moderate intensity version of exercise, the traditional version, also seems to improve pancreas fat. And this happened without weight loss, whereas the people in the placebo group continued to worsen in their pancreas. And people also got improvements in fitness, and importantly, in all the exercise groups, they improved their glucose levels, which is the problem of diabetes, having too much glucose. So we've got an amazing therapy here, and many of you already knew it was an amazing therapy, exercise. But there's also the little ins and outs of this as a therapy that you need to be aware of as a clinician. And this is trying to take cutting edge, latest evidence to inform our practice. So what we learn from this kind of evidence is that exercise is good, it improves fitness, etc., and it improves glucose. But it's also a potential way without weight loss to improve the pancreas and liver function, although not all exercise may be useful for that. And so part of this degree is about helping you think like this, to push your understanding of traditional exercise, traditional medicine, and to try and learn more about targeted, individualized exercise therapy for patients. So for instance, is this evidence saying that you shouldn't use HIIT training for an obese patient with diabetes? Well, no, it's not saying that. It's saying that that's useful for glucose improvement and fitness improvement. But if you're looking for improvements in the pancreas, you shouldn't expect it, for instance. Whereas moderate intensity continuous training will give all of those things. And so this is the way we think as targeted, accredited exercise physiologists. Exercise isn't just exercise. We use different forms of exercise, different modalities, different durations, different frequencies to target different therapeutic outcomes. So I may have an obese patient who also has osteoarthritis. And so for that patient, I would use muscle strengthening exercise. But we don't go in with the attitude of any exercise is good exercise that will solve all your problems. So I hope that gives you, firstly, a bit of an idea of what we do as exercise physiologists and what we specifically do here at Sydney Uni and our strengths at Sydney Uni, but also the type of approach to thinking that's encouraged here in the master's program, how we want you to treat what you previously thought was fact, and how we want you to think in the future as future clinicians and people that are going to change health in Australia and internationally. So I hope that gives you a little bit of a taste. And more specifically now, I'll just talk more broadly about the degree and the program and firstly start off with this idea of why would you be interested in a career in exercise physiology? Well, there are a few reasons here and it's different for everyone, but personally, from my experience, I still like working with people where one-on-one you make a difference. Not everyone is easy to work with. Some patients are lovely. Some patients are hard work, just like life. But I've had patients that at the moment, because my clinic is in the middle of Sydney, I get some patients that are very well-to-do that don't even work. They don't need to work. They have enough money. I've worked in a clinic in Tasmania where literally some of my patients couldn't afford the bus fare to come and see me. And working with that breadth of people in the community is just really great. And if that's the sort of thing that interests you, then a career in health sciences is a really good one, including a career in exercise physiology. It allows you to do things like solving problems. It's a really rapidly growing sector, particularly more broadly healthcare in Australia. As you've already seen, part of being an exercise physiologist is about keeping abreast of the evidence and lifelong learning. But another part is, let's be honest, is working in the medical and health field where you get Medicare, a Medicare provider number, for instance, and patients can get a rebate for your services with Medicare as well as with private health. So just to clarify, at the end of this program, if you're successful in completing the Master of EP at Sydney, you are eligible to apply to be an AEP, which gives you the ability to apply through Medicare, for instance, for a provider number. So why else would you be interested? Like I said, I think health management is a rapidly growing area in Australia, and particularly given the increasing prevalence of things like cardiovascular disease, which is still the biggest killer in Australia, but also things like diabetes, which are more rapidly increasing. Obesity continues to increase. But we also have these other things like there's an emerging problem with mental health in Australia, for instance, and we as EPs can potentially play a really vital role in the management of this for the country. So I think it's a great time to be an allied health professional, and in particular an EP, given it's such a young emerging field as well. So more broadly about our programs here thanks, Kyle. More broadly about our programs here at Sydney Uni, I know people are engaging because they're interested in the MEP program, which is a 1.5-year program. But we do offer a 4-year undergrad program here, as well as a 3-year exercise science program, and some other programs here. But specifically, what I'm talking with you about today is our new Master of Exercise Physiology, which is an 18-month full-time program. And I'll give you some more detail about that now. But specifically, this course is actually primarily intended for people from an exercise and sports science background. Can I get an indication of from people whether you have an ES background, whether you're finishing or you've finished an ES degree in Australia? Yes, thanks, Pascal. And yes, Kyle, thank you. And yes, from Shiva as well. Great, okay. And another BS, that's great. Okay, so this course is really primarily designed for you guys. It's to be eligible for the course, you need to either be an exercise scientist, so some of you may have already registered to be exercise scientists, but as long as you've finished an ES degree that has ES accreditation with ESSA, then you're eligible to apply. There is another pathway for people who don't have an ES background, which is called a graduate entry assessment. And if people want to chat to me about that, I can do that after today. Specifically, this is the program, and I'll give you a brief rundown of what to expect in each unit of study. But what I want to speak to more importantly is the feel of what we're trying to achieve in this program. So like I said, it's an 18-month program, so there's 3 semesters. And in the first semester, we recognise that people have come in as exercise scientists or equivalent of exercise scientists. And so what we want to do is one of 2 things. One is to start you thinking about how to apply the skills you already have into a clinical context. And secondly, really starting to give you real hands-on experience in applying those things before you go out with real patients by semester 2. So we do that with 4 units of study that technically are their own units of study, but this is a first for the university here, and it's kind of really cool and exciting to do, is you'll quickly find that these units are basically like one big unit largely anyway. They kind of don't operate separately, and literally to the point where in 5102, for instance, and 5103, you have a shared assessment task. So you don't even know which unit you're in when you're doing the assessment, because we mark from both units. And it's the same between 5104 and 5101. So I teach into 3 of these units, for instance, and most of the staff that teach into the units are also teaching into the other units at the same time. So in week 1, you'll see me in, say, this unit, but in week 3, you'll see me appear in this unit. And what that will hopefully achieve is the feeling that you're not learning discrete things in a unit of study that you then forget about by semester 2, rather that this is part of skilling you with a way of thinking that exists across all of your units of study. And like I said, we're really excited about this because it's the first for the university really to try and do this. And so hopefully that creates a really real experience for you. So I'll give you a bit more detail of how we've sort of approached these units. So we've called all of these units are mapped to what ESSA expect you to learn, the ESSA standards they're called, to be an exercise physiologist. So in the 5101 unit, it's all about the assessment, what we do as an EP when we're assessing someone. So when I have a patient, I have a referral from a GP, for instance, and so the first thing I need to learn to do is to understand the referral system and the communication system between other allied health professionals. So we learn about that in this unit. And then in this unit, the other thing that we do straight away with the patient is we start communicating with the patient and learning about their history. We do risk assessments of them, and we start some basic assessments of their physiology, not just their exercise, but things like their blood pressure, their heart function, their glucose levels, their blood fats, all of these things that go into their risk, their body composition. So then we might do a whole series of exercise assessments, from musculoskeletal assessments, things like range of motion of different joints, to strength assessments, to muscular fitness assessments with weights, free weights, machine weights. You might do cardiorespiratory fitness assessments on cycle ergometers, walk tests, and whatever. And what you're expected to do by the end of this unit is to basically know not just the suite of standard assessments that are used by an EP, but how to actually implement them, interpret them, gather information from them, to then report back to other allied health professionals, report back to your patient, and then use to prescribe for exercise as well. So in another unit, we focus more on things like the implementation of exercise, the design of exercise, how to take this sort of information and package it up using things like evidence-based practice. What is that? We learn how to actually understand that better. What is evidence-based practice? How do we incorporate that with what we've learned from the client and what the current guidelines are to actually give an effective management plan? So these are working together while at the same time you're starting to learn the specifics for the first time in your career, I guess, specifics of diseases that you will manage. And so ESSA break those down into specific called target pathologies, like the cardiovascular domain, the kidney domain, the metabolic disease domain, the respiratory or pulmonary domain, the neurological domain, the musculoskeletal domain, the mental health domain, cancer domain. If I've forgotten any, let me know, and apologies. But this is where you first experience some of these actual conditions. And so in metabolic diseases, for instance, by the end of the first 5 or 6 weeks, you are starting to become well-versed in understanding what the major metabolic diseases are that you will experience. Things like obesity, things like diabetes, type 1, type 2, polycystic ovaries, to insulin resistance syndrome, other insulin resistance syndrome, to sleep apnea, for instance, and then moving into chronic kidney disease management, into broader cardiovascular disease management, from things like coronary artery disease, angina, high blood pressure, hypertension, peripheral arterial disease, congestive heart failure, cardiac rehab, etc. So by the end of that semester, you are fully versed and equipped to actually go and work with those patients, which is great because by semester 2, we put you out in clinic with those patients and you have the skills to actually work with these patients and actually make a difference, because unlike many other unis and our old degree, you never had the full suite of skills to do that before you went out on your placement. So, but now you will, combined with what you've done in your ES degrees. And at the same time, you're also doing a dedicated unit on musculoskeletal health, where we start to understand the full assessment suite of assessment tools available to assess musculoskeletal health, as well as start regional assessments and prescription for muscular health as well. And there's a second unit of that that appears in the second semester. So really, by the end of the first semester, you're equipped to work with a large portion of the sorts of patients that you will see in real practice, using the standard suite of skills and understanding, from things like record keeping to documentation to assessment tools, things like how to run a 1RM test with a patient, to how to do a maximal exercise test and an ECG test with patients, and how to refer on, all these sorts of standard routine tasks for an exercise physiologist. And as it is applied to people with cardiometabolic, kidney and respiratory diseases. By semester 2, you go out on your first placement, and I'll get to that in a second. And then you start learning about patients with mental health conditions and those with cancer in a unit that we call exercise physiology and client care. And it's in this unit that you'll dive down a little bit deeper into learning more detailed and practicing more about your communication skills. That includes things not just like interprofessional communication with medicos and other allied health professionals, but also with patients. And that includes things like cultural competency as well. And at the same time, you'll do another unit of study in neurological conditions. So these are patients that have things like dementia, cognitive decline, stroke, cerebral palsy. So I'm trying to think off the top of my head all the other ones that are in there. Parkinson's disease, Lewy body disease. So all of the neurological conditions are packaged into this unit, as well as conditions of frailty and more broadly aging. So things like osteoporosis, sarcopenia, fractures, etc. And again, as I said, you go into another more detailed unit on musculoskeletal health assessment and prescription there as well. So really, by the end of this first year, you have actually met all of the ESSA criteria to effectively work as an exercise physiologist, and that includes being put out on placement. You'll notice that we don't have units dedicated to things like professional practice and cultural competency and communication, etc., and things like pharmacology. Rather, they're embedded throughout these units where they're appropriate. So, for instance, in this unit, cardiometabolic diseases, you'll learn about the cardiovascular drugs and the metabolic disease drugs. Whereas in musculoskeletal health too, you'll learn about pain medication and NSAIDs and inflammatories, etc. And in client care, you'll learn about conditions for mental health management. You'll learn about pain management for cancer patients as well. So you can see our approach. We have condition-focused units of study and core skill units of study with cross-cutting themes embedded throughout those units and repeating constantly throughout the units. So in the final semester, which is in year 2, things change slightly. For a lot of that time, you're out on placement in your final 2 placements that, again, as I said, I'll get back to in a second. But you also get the opportunity to do what we call a selective unit. And this is the first time we've ever had this in the master's degree, where you get to actually do something of your choice. But it's got some constraints on it. ESSA won't allow us to let you go and do, introductory French or engineering 101. It has to still have something that uses your skills as an emerging EP. And so these units are, and they're really cool units. There is a unit called FHS Abroad where you can actually go on a placement overseas to some partner countries like Vietnam, for instance, where you can actually work as an allied health professional in that country for it's usually 4 or 5 weeks, and come back and you reflect on that experience and how it may change you and help you as an exercise physiologist. You can do the same thing in a unit called Indigenous Communities, where you can actually go out and do the same thing within Australia, specifically in either a regional or a city-based Indigenous community. And that's one of the core themes that we teach here at the University of Sydney, the importance of Indigenous Australian health and our role in making a difference to the future of all health for all Australians. So that's really important for us to give this opportunity for you guys to also be able to start making a difference even while you're still studying. And lastly, there's another selective here that you may choose to do, which is called Experience in Exercise Physiology, where you can do one of many things. Like, for instance, you could go out in the community and come up with a project that you're going to implement in the community as a emerging exercise physiologist, or you might decide to join with me or one of the other research teams here at the university and actually get your hands dirty being a research assistant with us for 5 weeks, like in the research study that I spoke with you about earlier. So it gives you a little bit of a chance to say, what do I actually want to be as an EP in the future, and what can I start doing now to specialize and to start distinguishing myself and branding myself with a speciality or a focus that I want to have. So hopefully that gives you a little bit of an idea of the structure of this course and how and the big theme behind how we're approaching it and our goals for the course for you. So I guess I should speak a little bit more broadly about, firstly, your clinical education. I mentioned there's 3 units of study where you're on placement in this degree. We look after all your placements, and we have a unit here called Work Integrated Learning, or WIL, that are responsible for putting you on your placement throughout these 3 units of study. And they will ensure that you actually meet all the requirements with ESSA by the end of this, to complete your logbook successfully and to meet all the hours and the learning requirements to become an EP at the end of it. These placements occur in many of the public and private hospitals throughout Sydney and beyond. They also largely occur in private practice and other community health centres. And they also include some rural and remote opportunities as well, which students find pretty amazing, to go out rural and remote for their placement experience. So this is a requirement for ESSA to do this. Be aware that if you're signing up to do any MEP program or any EP program as part of your placement, you need to get New South Wales health requirements, which include up-to-date vaccinations, criminal record checks, working with children checks, etc. That's standard practice, and you'll be expected to do that as an EP eventually anyway. So I guess the question then becomes, you're probably considering offers not just from Sydney but from elsewhere, and so this is the pitch of, why would you choose Sydney versus elsewhere? And in short, I shouldn't make your decision for you or give you the answer for this. This is a very individual thing. At this time of your life, I personally encourage you to think of this as an important 18 months of your life that you want to enjoy. And if that means commuting 6 hours to get to university and you're going to be miserable, then I'd strongly suggest you rethink it. But generally speaking, I think that students would say that the experience they have here at the university is pretty amazing. And it's certainly a great university to work at and teach at. I continue to enjoy it. As you probably are aware, it's one of the top 50 universities consistently in the world. It's actually the first in Australia for graduate employability. We've got a really good track record of students coming out of our degrees, including from our MEP, and being snapped up really quickly in jobs. And we're actually top in many of our disciplines, including in the health sciences, which is what exercise physiology is in. So consistently for the last 3 or 4 years, we have been number 1 or 2 in the world for this type of teaching in rehabilitation sciences involving exercise. So it's a group of highly experienced professionals that teaches you in a really cool environment. That's a really exciting environment to be working in. And this includes a great campus and campuses. They're, if you haven't been to Sydney Uni campus before, I highly recommend it. Awesome buildings, really great vibe, and a really exciting place to be for 18 months. So I guess specifically though, with respect to the MEP program, and sorry, I'll just double check on my time here. Why do the MEP at Sydney rather than elsewhere? And again, I'd encourage you to recognise that this is a really individualised decision and an important decision to make. But the first thing that I'd like to say is that all universities will get you AEP accreditation. At the moment, we have qualifying accreditation, not full accreditation, but that's the nature of having a new course. You can never have a full accreditation until the course has been run its first year. So we're applying for accreditation at the moment. So all universities with AEP accreditation will get you the same outcome. You'll still be an AEP, like a physio. You can learn to be a physio anywhere. You're still a physio. A physio is still a physio. An AEP is still an AEP. All universities still have to teach you core professional practice skills like the ones I've spoken about, and you still learn to work with real patients on placement. We all have to do that. But Sydney is different to the others in this respect in particular. We have a real emphasis and specialisation on training for obesity, diabetes and cardiovascular disease, as well as mental health. We are the world experts in these areas. And particularly, we are world experts, I should say, not the world expert, but arguably probably the national experts in most of these areas. It's a very multidisciplinary hands-on experience at Sydney. So literally you go out on placement with students from physio and other allied health professions. So you're actually working with people like you would in the real world. You're working with a multidisciplinary environment, unlike what you may have experienced in your undergrad degree where it's just all about exercise people. And it's a very authentic experience. I think the fact that you get to be involved in your degree as in part of the research, for instance, or in cultural competence or with engaging with the community makes this a real experience. And to add to that, a lot of this teaching takes place, or some of this teaching for the new masters takes place in what's called the Charles Perkins Centre, which is at the main campus of the University of Sydney. It is formally the university's contribution to managing the problems of obesity, diabetes, and cardiovascular disease. So it's got many of the world's leaders there trying to come up with new solutions to manage these target conditions. And so you are actually immersed in this facility, which is actually within RPA Hospital. So you're working in a real facility where everyone else is also working towards trying to come up with solutions to these conditions. And you're working in a hospital setting where there's real patients coming through, for instance, and you're working in a real laboratory where patients are coming through. So it is very cool. And so it's probably very different to what you've experienced in your undergrad, where you go into a prac class and you just got your mates with the prac class with you. In this experience, you are literally going into a clinic that's in a hospital facility where outside the door there are patients going in to see doctors, etc., just all around you. So it makes it really authentic. And on top of that, we have a brand new campus going up that will be finished towards the end of the year for your second year, called the Susan Wakehall building, that's just over the road from the Charles Perkins Centre. And this will have all the cool latest teaching facilities and pretty cool. So that's exciting. Like I said, it's multidisciplinary. It's hugely hands-on. Just as a throwaway, and I'm sorry, I'm just getting a low battery error on my computer, so massive apologies if I drop out, but hopefully I get there before then. As an example, it's so hands-on that in this master's degree in week 11, your assessment task across 3 of the units of study is to have a real patient come in, and you're given about an hour with that patient to do everything you do as an EP, from meeting them, taking a history, assessing their risk, doing all sorts of assessments on them. That's how hands-on this is. So basically within week 1 or week 2, you are getting your hands dirty. Within week 11, you are doing it as part of your major assessment with real patients. So it's very much about real authentic learning in this degree. And come on, computer. Like I said, being one of the top research unis, I think adds to this authenticity and this engagement. You're always learning the latest evidence by the people that are actually driving the evidence and collecting the evidence as the top researchers. Many of the people teaching you are the ones that are writing and have written the guidelines for exercise for all the different conditions you'll be learning about as AEPs. And so you're certainly getting it from people who know what they're talking about. And there's the chance for these real opportunities, like I said, including FHS abroad and Indigenous community placement as well. So I think it's a really cool program. At the moment, it's being run for the first time, so my head's underwater. I'm trying to get all the final stuff prepared and the documentation for the accreditation finalised. But I hope it gives you a bit of an idea of how exciting this program will be. And I'm not sure, firstly, how well this will work to try and take your questions, and secondly, whether I'll have enough battery left on my computer to do it. But if neither of those are successful, again, I'd just like to extend the opportunity to contact me if you do have further questions that you want to discuss, including email or phone. I'm more than happy to have a chat. If at all it's useful to come out on campus, you're always welcome as well. I'm out at the Charles Perkins Centre tomorrow. If someone wanted to pop in and say hello, and I can show you the facilities and answer questions. My email address, Pascal, is I can't put it up.
Should I just type it out?
Yeah. Yep, if you could. It's just my name, and you can always Google me and that should come up straight away if there's any problems. nathan.johnson@sydney.edu.au. But thank you very much, everyone, for listening.
Thanks,
I hope
Nathan.
it helps with decision making. And if I don't ever see you again, I do wish you all the best with your decision making and your career. I hope it's in exercise physiology. Maybe see you out in practice, or see you, at an ESSA conference or something like that in the future. But I do hope you enjoy the next couple of years, no matter what you do. Thank you.
Excellent. Thanks so much, Nathan. If anyone has any questions and you don't get the opportunity to ask now, please feel free to email myself or Nathan. I'll stop the webinar right now, but like I said, feel free to get in touch at a later point. Thank you.
Thanks very much, everyone.